just finishing a couple of bullet points on my script that I should have written before I sat down, but they just came to me. Just getting that down, adding to the world building, just like that. Oh hey, I didn't notice you. Actually I did, but it's key to the world building. Again. My name is Dr. Calliope. I'm not a real doctor, just for the purposes of this particular exam. But don't worry, I've been playing a doctor for several years now. So I have a vast approximate knowledge of many things. Now, would you mind just giving me your name and date of birth? Okay, so in my mind I get to make up your name. Today we're going to call you Trash Boat Jones. And your date of birth is 4/20/69. Nice. Now, would you mind telling me your preferred name and how you like to be addressed? And this is where I, again, make it up. So, your preferred name is Trash Boat, but you like to be referred to as the deity among humanity. Quite fitting, I think. Excellent. So, how are you doing? I'm assuming good, because otherwise that makes this plot a little awkward. We're gonna say good. I shouldn't necessarily have to write that down, but it adds to the sounds. Okay, so I'm gonna ask you a few questions about your current health, your medical history, all right? Okay. Do you have any current illness or any current pain at all? Okay. Definitely chronic insomnia. And I think in my mind you have anal glaucoma. Can't see your ass going into work. It's very common. And definitely cool guy syndrome. Now you take Adderall. Very good. And lastly, I think you've had a particularly serious case of ligma, but not the Sugma variant, just regular ligma. So that's good. Okay. And any changes to the medical history we have on file? I lift up the paper so that it sounds like we have a medical history. In reality, there's nothing on the clipboard. Yes, I see that currently you have 3 legs, right? Are those all load-bearing? They are, equally. Very good. And any changes to your family history? Looks like I have an RD 175 and a Rico RDC1. Is that how you pronounce it? I apologize. Sorry. Just when I researched, I just read, didn't listen. Oh, I'm sorry to hear that. They're both deceased. My condolences. It's been quite a long time. Back in the 90s. I see. All right. And what about your allergies? Any changes there? Okay. You're allergic to these nuts. Got them. And what about your medications? Any changes there? Okay, no medications, just getting high on life. All right. Very good. So I've gotten all the information that I needed. Now I'm going to set down this clipboard. I'm going to try to make sure that it's not loud when I set it down, but oftentimes I do fail in that. Right. So today we are performing a general examination of you. It shouldn't take too long. And yet it still will take a long time. I'm just going to sanitize my hands real quick. There's really not any point because you are a camera, but it adds to the immersion and I like the smell. It's nice when one is filming and the entire time the room smells like pineapples. Okay, very good. Now for this examination, I'm not going to use any gloves. This is mostly because it's kind of humid today and the night dry likes to stick to the skin a little bit. So is that okay with you? Alright, just want to make sure. Now from here onwards, I am going to need to be touching you. Do I have your permission to do that? Okay with you? Excellent. Even when you're a camera, we want to practice basic common courtesy, right? Don't want to feel all over you without letting you know first, right? So let's go ahead and start with grabbing some vitals here. Okay, and there we are. Now I'm going to very slowly and carefully take out this thermometer here. There we go. Success. Now I'm going to have you open your mouth for me, and I'm going to put this underneath your tongue. Then I'm going to have you lay your tongue on top. So I'm going to turn it on, and I'm going to just put that under your tongue. You can go ahead and lay your tongue on top of that. Good. And now I hold this here for a few seconds until the thermometer wants to yell at me because it's not going in anything warm. There we go. And I just turned it off, but I'm going to write a temperature down anyway. So, I'm just going to pop that back in its case and put it off to the side. We assume that the doctor later on sterilizes said instrument. However, I don't recall the last time that was actually sterilized. I don't use it in real life, so what's the matter? Let's see, your temperature is going to be, let's just go 69.9 degrees Fahrenheit. We use the imperial measurement system here because I'm from the US and metric confuses me. Now, let's go ahead and grab your blood pressure. For this, I'm going to use the stethoscope here and our sphygmomanometer. In this video, I didn't necessarily have to take your blood pressure or your vitals in general, because generally that happens before the doctor talks to you, but I like saying the word sphygmomanometer. I'm just going to grab that. And I'm just going to pop the cuff on your arm. Do you have a preference as to which arm we use? Okay, I get to decide. Let's go with this one. Now, this is going to be loud, and it's going to be edited down in post. Just want you to know that. Okay, and then I'm just going to go ahead and grab the stethoscope and pop that in my ears. Now, this is a juggling act because my lap can only hold so many things, so I gotta do this quickly, make sure that nothing falls. There we go. All right. So I'm just going to put the stethoscope right, crook your elbow there. I'm gonna hold the dial, and we're going to inflate the cuff. Okay? And make sure that the little valve is closed all the way. And then we proceed. Okay, and then I let the air out of the cuff. On a human, this would be so we can look at your diastolic blood pressure number, but here it's just so we can loosen up the cuff a little bit so that it doesn't inflate so much it falls out of my hand. And then we're going to do it again. Okay, and I'm going to go ahead and open that valve because, as I said before, the cuff is about to jump out of my hand. Okay, very good. Close that back up. And we're going to take the cuff off. Cuff is still partially inflated when I put it back down. That's made for some awkward noises in the past. And I'll just take the stethoscope out for the moment while trying not to get caught on my hair. There we go. Okay. And I'm going to write a number down. Let's go with 405 over 22 millimeters of mercury, mmHg. Now let's go ahead and take your pulse. Since I measured your blood pressure on this side, I'm going to take your pulse on the other side. If you could just show me your wrist. And this is where I hold out my own. And I pop my fingers on the radial pulse point. And then we wait here for hopefully about 15 seconds. Okay, very good. And then I jot something down that looks like it would probably be a real person's pulse. 80 beats per minute. There we go. All right. So now I'm going to take a little look at you, okay? I'm going to sit back a bit. And my pants are going to make really weird noises on the seat that I'm on. Fortunately, that's just the nature of the beast. And we're going to ignore the airplane flying by as I just do one of these numbers. Just tracing over what would be your head, your shoulders, down your arms, face, neck, along your chest, arms, forearms, hands, and lower body. Very good. So I'm not seeing anything out of the ordinary that we'll need to investigate later. We're going to go ahead and move on. I'm going to get up a little closer here. And I'm just going to be feeling around your head a little bit, looking at your scalp, okay? So I like to just come in close and feel around on the top of the camera. This makes some really good noises when you have gloves, but not everybody likes gloves. And my arm gets tired, so then I switch. I just keep going to the side and whispering into the microphone. Again, adds to the realism. And I switch to the other arm because my right arm is about to fall asleep. I just keep looking, feeling around, just looking around the ears, which are simultaneously right next to the camera and also right here, just depending on where I need them to be for the part of the exam. Okay, just going to feel your head for any lumps or bumps. In the past, this would be where my tripod acts like she's somebody and would make a whole bunch of ruckus. But I was kindly donated a wonderful tripod. Makes me feel like a real professional, you know. So this part is no longer super noisy. Good. I just want to have a little look at your face. I'm going to make sure that everything is symmetrical and even. Okay. Eyebrows, your eyes, nose, mouth, ears. Okay, very good. And I'm going to have a little look in your eyes. So, grab a little pen light here. And I'll get a little closer still. And I'm just going to shine this light into your eyes. It might be a little bright, okay? You can blink. And then I get close and a little far. Switch hands. Get pretty close. The echoing words add to the ASMR of it all. And then far. And then we're going to do the swinging light test. I want you to look straight ahead for me. Since you're a camera, that's not any problem. I'm just going to bring the light in, and in, swing, in, swing, in, swing, in, swing, in. Good. Very good. Now I want to just do a little test called Follow the Light. This is a staple of any sort of ASMR examination when the eyes are a key point of focus. So I'm going to just sit back here so we have a little bit more room. Again, my pants will make a lot of noise. It annoys me, but luckily I don't hear it much in post. I'm going to have you focus your eyes on this light. I want you to follow it using only your eyes without moving your head. Again, won't be a problem since you're a camera. We're just going to go out to the side. And while I'm doing this, I'm trying to watch in the little monitor, the viewfinder, what have you, that's out to the side. I'm watching that in my periphery so I can make sure that you can actually see where the light is. I have very poor vision without my glasses, so this is kind of difficult. And I mess it up a lot. Okay, and then we're going to go up, down. Sometimes I like to sing this part because, well, I like singing. Some people like the singing. And I have a tendency to sing everything I'm doing when I'm by myself. It translates over into film sometimes. Okay, I'm going to go diagonally up, diagonally down, diagonally down, diagonally up, diagonally up, diagonally down. Switching hands because my hand's cramping. Diagonally down, diagonally up, and we ignore the drag racer in the background because seriously, who drag races at 1 p.m.? And I'm just going to do the accommodation reflex test. I'm going to have you look at the wall behind me. Okay? And then if you could look into this light here, and I want you to follow it using only your eyes without moving your head. And we're going to go in and out. In and out, in and out. Then I switch hands because this is it's a little delicious part of the exam. You could just look right here. Okay, we're gonna go in and out, and in, and out, and in, and out. Very good. Now, I'm going to write some stuff down. Usually I write N/A, N/A. All good. No probs. And this is what I generally write. under every section that I have a spot for on my script. Now we're going to take a little look at your ears. We're going to use an otoscope here and have a little speculum here. It's probably been on this otoscope for 3 months straight. And I'm going to flip on the little light. I desperately need to get another battery, but I'm too lazy to do that, so you get a faint little light here. And I'm just going to be looking inside of your ears. I'm going to be looking for any impaction of cerumen, any sort of perforation on the tympanic membrane, signs of infection, things of that nature. Okay, I'm going to start with this side, and I'm going to pull the ear up and back, and just going to gently insert the otoscope into the ear canal. And this is where I usually use my fingers to rub the plastic bit of the otoscope. Again, it works much better when one is using gloves to make a sound that sounds like it's inside of your ears. And I get real close to the microphone and usually talk about how the external auditory meatus looks, the ear canal, as well as the condition of the tympanic membrane. Whether I see any sign of cerumen, if it looks swollen, if there's irritation, that sort of deal. And sometimes I don't realize that I'm not exactly off camera and it doesn't look super realistic, but it happens and I'll fix it in post. And then I'm just going to take a look at the other side real quick. I'm just going to pull the ear up and back, and then I'm just going to whisper here and talk about the ear canal, what the color looks like in my mind, if there is any perforation on the tympanic membrane, if I can see the cone of light bouncing back from the tympanic membrane from the otoscope light, and noting the color. Again, all these little details that I've been talking about for years. And then I just pull away and I switch off the light and I say, looks good. Now, you haven't had any problems with your hearing lately, have you? Okay, I'm going to do a quick little hearing test, if you don't mind. Right? So I have a 512 hertz tuning fork. This is a C note. And I'm just going to strike the tuning fork, and I want you to tell me whether you hear it on the left side or the right side. Okay? Have you close your eyes for me? I'm just going to strike the fork. Good. Good. Remembering the soft smile. Good. Hoping that the microphones actually pick up the tuning fork. Sometimes it's way too loud. Certain frequencies they don't pick up at all. So then I look stupid the whole time. Last one. Right in the middle. Very good. And I'm going to have you open your eyes, even though you had your eyes open the entire time, I imagine. And I'm just going to, real quick, take some notes. This is where I make sure I'm on the right track, that I didn't miss any steps that I have to film later. All good. No probs. Okay. And I just want to take a little peek at your nose real quick. I'm going to have you tilt your head up for me so that I can get a look inside. Of course, since you're a stationary camera, this isn't really what's going on, but we're pretending. And I'm just going to just take a little look here. Gotta make sure the light's still in view. And I say something like, nasal passages look clear. Not seeing any deviation in the septum. No perforation. It's good. It means you're not doing cocaine. Or at least not long enough that it's damaging your nose. Okay. And you can go ahead and tilt your head back down. Alright? And I want to take a little look inside your mouth. So I'm just going to be having you open your mouth. And I'm going to just push your tongue down so I can see your throat. So hold up the light and just hold the stick in midair while I take a look. Generally right at the tripod. Gotta make it realistic, you know. Okay. Looks good. I'm not seeing any redness or swelling. You don't have a sore throat, right? Okay, very good. And I'm just going to take a look inside your mouth. Look at your teeth. Look at your tongue. Okay. Would you mind just sticking your tongue out for me? Okay. Can you move it to one side, the other, up, down, again, all while looking at the tripod. Okay. And can you lift your tongue to the roof of your mouth? Get very close. Make sure the light's in view. Okay, very good, thank you. You can close your mouth. All right, and both of these are done. N/A, N/A, all good, no probs. All right, now I'm going to be taking a look at your lymph nodes, all right? So you're just going to be feeling me, palpate, and maybe even rolling the skin a little bit. See if any of those are distended, all right? And I'm going to start with the occipital nodes at the hairline, base of your neck, okay? And I'm just going to hold my hands on the tripod for a little bit. And I have a little sheet of paper that lists all the different lymph nodes. I used to memorize it, but I would often screw it up when I memorized it. Now we're going to come to the preauricular nodes in front of the ears. And the postauricular nodes behind the ear. I'm going to feel the parotid glands right below the ears. Okay, and the jugulo-digastric. That's a new one I've added. Okay, and I'm just going to feel the submandibular right have my fingers underneath the lens and the submental. Okay, and then down to your neck, tripod. We go to the superficial cervical, deep cervical chain, posterior cervical, and along your clavicle we have supraclavicular. This is where I dance my fingers in midair, make it more believable. Okay, very good. I didn't feel any swelling in any of your lymph nodes, because you don't have any. And we're going to go ahead and move on. I'm going to take a listen to your heart and lungs. We're going to bring out the stethoscope again. Okay, so when I take a listen to your heart, I'm going to have you just breathe normally, okay? All right, so I'm just going to press this to your chest. And this is generally where I start throwing out the names of the different atria, ventricles, right? See, I don't really understand it myself. Usually I go something like atrial, pulmonic, mitral, tricuspid, mitral, tricuspid. And then I probably mess it up, just like I did there. I just hold the stethoscope midair. I usually just double check that I am doing all right. Nothing has to be redone. Atrial, mitral, pulmonary, atrial, pulmonic, tricuspid, mitral. Pretty sure. It's usually what I'm running through in my head. Okay, sounds good. And I don't have a bell on my stethoscope, only a diaphragm. So, though I should be listening with a bell in some areas, I don't because I can't. So, we're going to take a listen to your lungs. I'm going to prompt you when to breathe, and I'll have you take deep breaths in, deep breaths out. I'm going to listen to your lungs, okay? Right, so take a deep breath in for me. And out. Deep breath in. And out. I'm counting with my fingers as I go. Deep breath in. And out. 6 places on the front, 8 places on the back. Deep breath in. And out. Usually by the end of this, I'm pretty lightheaded. Deep breath in. And out. Last one. Deep breath in. And out. Excellent. So, I can finally take the stethoscope out of my ears. Hurt your head a little bit, but things we do for the process, for the art, right? Okay. I'm just going to go ahead and take a couple of notes real quick. i.e., I'm going to make sure that everything is still going smoothly. Okay. And now we're going to take a look at your abdomen. So I'm just going to be taking a listen real quick. This is where I chide myself for putting down the stethoscope. And I'm going to listen to the 9 different sections of the abdomen. Now in real life, I'd have you lay down for this, but stationary camera, I don't really want to move. So, alright. So I want you to just breathe normally for me. I'm just going to take a listen to how your organs sound. And isn't that a goofy way to say it? I mean, it's true. I'm listening to your organs, but I mean, if I just pulled up to you and I was like, hey, let me listen to your organs, that'd be pretty freaking weird. But here I am, simulating listening to your organs. And it's kind of dope. Okay, very good. And I'm going to pop the stethoscope out, and my ears, again, are thanking me. And sometimes I decide to take a little break because I hear a train in the background, but sometimes I just want to live a little. And I'm going to say, let it be in there. If it's in there, it's in there. So I'm just going to do some palpation on your abdomen. The first time I do this, it's going to be with a lighter hand to it. And the second feel is going to have some deep pressure to it. Okay, so that deep pressure is going to be a little uncomfortable, but it doesn't take too long, and I'll let you know when I'm going to do that, okay? Alright, I'm going to have you continue to breathe normally, and I'm going to take my hands hand over hand, and just move them around as if they were floating on waves. That's generally what real doctors, real medical professionals are doing. It gives me good timing when I'm actually simulating what needs to be done. Okay, and now we're going to do that deep pressure, alright? So just try to breathe through it. It doesn't take too long. I say as I am palpating into air. Although really, it's not a pleasant experience. Really moving the shoulders so I get the crinkly shirt sounds. Okay, all done, alright? Doing okay so far? Alright, I do that just to, check in, fill the silence a little bit, make sure that my brain's still running on the right track. Alright, so if you wouldn't mind, I'm just going to sit back real quick. Pants make the noise. And I want to take a look at your arms, your hands, fingers, legs, your extremities, if you will. And I'm just going to take a look. Okay. I'm going to feel on your arms and your hands with the back of my hand. I'm just going to check the temperature. Okay, very good. So that all feels warm to the touch. I'm going to take a look at your hands. Okay, I want to look at the nails and their condition. This is where I look at my own nails and go, Jesus Christ, I need to moisturize. Yikes. And I'm just going to push on each nail, and I'm going to check the capillary refill. It's where I push on my own nails and go, dope, I have alright circulation. I do each one, all 10. Cool. And I'm just going to look at the skin, at the joints, feel around a little bit. where I feel around on my own hands. Feels pretty nice. Again, gives good timing. Dear God, I need some lotion. Yikes. Okay, very good. And I just want to have a little look at your legs and your feet. So I'm going to scooch back a little bit, and then I bend forward a little bit, mostly because I don't want to move, because I don't really want to, I'm comfortable where I'm at. So just looking. Okay, and I'm going to look at your feet here. I'm just going to feel around your ankles. And I'm checking for any pedal edema. And I'm going to feel your pulses on your feet, pedal pulses. And we do the post-tib as well. Okay, and I'm just going to feel around your foot, feel around your toes a bit, okay? Again, I'm just bending forward slightly for the thing. Not actually even, I'm still like 2 feet off the ground. Okay, I'm just going to push on your toenails and check the capillary refill of those. Okay. Very good. All right. So I'm just going to do my final notes. Sure I didn't actually accidentally leave something out. All good. All good. Nice. All good. I like writing all good because I like the swoopy L's and the swoopy G. Okay. Alright, so that concludes our examination. And thank God, because it's really hot in this room. The ASMR equipment is very warm. Do you have any questions for me at all? Okay, and you don't, because you're a camera. Alright, I didn't see anything that was out of the ordinary. I don't think we need to follow up on anything. You look very healthy, and I am quite pleased with your results. Right? Okay, so if you don't have any questions, I'm going to go ahead and sign off on our paperwork here. That's because I like writing my signature. Big swoopy. Very good. Alrighty, and that's going to end it. So, in the timestamps, this is where I write final bits. Thank you so much for coming to the office to get this examination with me. Really appreciate having you. I hope you have a whale of a day. Oops, messed it up. And a good rest of your night. Thank you. Bye now. This is where we cut it. Thank you so much for watching. I really appreciate it. Please like this video if you want to. Comment if you'd like to. And subscribe